Welcome to the Code of Life podcast. I'm Randy Neal. Okay, I'm going to tell a sad story now, but in no way is this podcast sad. This podcast, in fact, is incredibly empowering. It's about women helping women, and you're going to learn a lot. So you're going to want to stick around and listen to it. But I did want to tell you this story because it really sets up why we're doing this podcast. About a decade ago, a friend and colleague of mine was diagnosed with cervical cancer. She was in her mid-40s. She had a great husband. She had 2 young kids. And she was my running buddy. She was one of the fittest, healthiest, smartest women I knew. And she died within 9 months of diagnosis. She's one of 400 women in Canada who are killed by cervical cancer every year. And globally, that number is much, much higher. Cervical cancer kills 1 woman every 2 minutes. The question is, why? Cervical cancer is a completely preventable illness. The HPV vaccine and an accurate test that women can take at home is enough to eliminate the disease altogether. Nobody should be dying from cervical cancer. 2 scientists are at the forefront of this fight to eradicate it. Dr. Gina Ogilvie is the Tier 1 Canada Research Chair in Global Control of HPV-related diseases and prevention. She's also the Senior Public Health Scientist at BC Centre for Disease Control and Senior Research Advisor at the BC Women's Hospital and Health Centre. Sarai Racey is a postdoctoral research fellow at UBC. She completed her PhD in epidemiology. Her current research focus includes the implementation of a digital health platform for HPV self-collection in women underscreened for cervical cancer and a tailored messaging intervention to improve uptake of HPV vaccination in BC. Welcome to you both so much for coming.
Thanks so much for having us.
So we're going to talk first about, I think, Sarai, this was something that you told me about. We're talking about vaginas today, which I'm very excited about. And you described the HPV as the common cold of the vagina, didn't you?
Yeah. So I think when we talk about HPV, it's really important that for a lot of people, it's still really stigmatized to talk about having an HPV infection, to talk about cervixes, to talk about vaginas. And so when we talk about HPV, when I'm talking to women, I often like to remind them that HPV infections are incredibly common. And to use the analogy that it's like the common cold for the vagina that a friend of mine had passed along. And I really loved that phrasing to really help women feel comfortable about that and realize that we've all got it. It's okay. And we can kind of move forward and have more conversations.
Can we get into kind of an cervical cancer one-on-one? Mm-hmm. What does HPV have to do with cervical cancer and why are the two?
Yeah, it's a great question. So HPV is the virus that we know causes cervical cancer. So, as Sarai said, it's a very common virus. So probably about 80 to 90% of women at some point in their life have an HPV infection. The majority of those infections clear. Our immune system is able to clear, but a small percentage stick around, and a small percentage of those then go on to change some of the cells in the cervix to move from a precancer to a cancerous stage. So what we know is that by eliminating infections with HPV, we can then eliminate a cervical cancer.
So tell me why you got into this study. Was part of it frustration? Like we can...
Yeah, I am just a very practical person. I had the privilege of training in family medicine and I had the privilege of training in public health. And what was clear to me was we had all the tools. We had a vaccine. We had a great screening program. We have the ability to treat this cancer early. So really, there ought not to be any cases of cervical cancer. So for me, the question then moved from, with all this technology, all these opportunities, why is this still happening? Why do we not have elimination of cervical cancer? So, and I think I was also driven and motivated by the fact that we know that when women are ill or when women die, and you told the story of your friend, it has not only the impact on the woman herself and her family, but women have such a key role, particularly the age you're describing and the age that women get impacted by cervical cancer. They have such a key role in their families, in their communities, and the wake, the long-term outcomes and consequences of losing a woman at that age goes beyond the singular tragedy that it is, but just has tentacles way beyond. So for me also, there was this added motivation of ensuring that these women who had such critical roles stayed with us and contributed, had lived full lives, not only for themselves, but of course for their families and their communities and their colleagues and their partners and so on.
And Sarai, let's talk about, because you do a lot of what you call vaccine confident research about trying to ensure that, because the HPV vaccine is available for everybody in British Columbia, school-aged girls and boys. Is it boys now too?
And boys
so
as well.
Boys as well, yes.
Right. So what part of this study did you get into? And give us some of the stats. Like, how many people actually get immunized in BC now? What's the rate? Do we still have a ways to go? And where are the challenges, do you think?
Yeah, no, that's really a great point to think about when we think about cervical cancer prevention and thinking of it from two different spectrums. So we talk about primary prevention. So this is prevention of getting the infection to start with. And that's where vaccine plays such a critical role in preventing cervical cancer in the future, as well as other cancers that are caused by HPV infections. And so in British Columbia, we introduced the immunization program in 2008. The HPV vaccine was licensed in 2006 in Canada, and so the program was introduced primarily to start with grade 6 girls. But we've had a universal program now for the last 2 years, so boys were included in that. And I think in terms of uptake rates across the province, since the introduction, it's remained sort of hovering just below 70%. So thinking that, we've got 30% of students, children, sons, daughters who are not uptaking this vaccine. And we are so privileged to have a vaccine to prevent cancer. And so when we think about a project to try and improve that uptake rate, our target was really thinking about parents, because these are children. So in grade 6, they require parental consent, or parental consent is sought, I should say, for immunization in the schools. And so it's really trying to open the door to have a conversation with these parents. So when we think about vaccine confidence, one of our colleagues used that term as opposed to vaccine hesitancy. So how confident are we in vaccines? We see that, that there's a real spectrum to that, of which those that we would sort of classify as vaccine deniers, they make up such a small portion. We're thinking 2%, right? This is not a large group. But there's about 18 to 20% of Canadians who are on the questioning, thinking about vaccines, either under vaccinating or just declining certain vaccines. And the HPV vaccine happens to be one they decline more often than others. And so when we actually open the door to talk to parents about, what are some of your concerns? What are some of the challenges you have with accepting the HPV vaccine over another vaccine, like the hepatitis B vaccine? What brings to mind some of the issues for you? And a lot of it still struggles around that it's linked to a sexually transmitted infection, and that they are not comfortable with having their child immunized at that time and want to delay that. So it's a lot of work around talking to them about why vaccination before children are ever sexually active is so important in terms of preventing that infection. So there's a lot of sort of education around that, and also reassuring parents that, their concerns are valid and that we need to listen to them and have those conversations.
As we talked about earlier, Gina, this vaccine saves lives. This vaccine could eradicate cervical cancer. Just give me your kind of short explanation about why the HPV vaccine is so important in Canada. And then I'm going to talk about around the world, why it's also a challenge.
As we outlined earlier, cervical cancer is caused by HPV. And the vaccine has about a 98% effectiveness. That means if you get the vaccine, you are highly unlikely to get infected with HPV. And because of that, then, we just don't have that progression that I described to go on to cervical cancer. As Sarai just described earlier, though, one of the key things we do know is that it's a preventive vaccine. So you have to get it early, and you have to get it young. You have to get it young for two reasons. One is that we want to get it before young people are sexually active. So that's why we look at those school-age children, because very few, if any, are sexually active at that age. But the other reason we know is that young people have much better immune responses. Their immune responses are very robust. They create great antibodies. And those titers, those antibody titers, those antibody levels last for a long time. So we want to get them vaccinated young so that we have that sort of prevention. So what that means is we can anticipate elimination, but we need to get the vaccine rates up, and we need to have that time for the vaccine to work, because we have to get it to people at such a young age. So of course the issue then is there's a whole group of women sitting around who didn't have the privilege to access the HPV vaccine. Yeah. So we need to also look, as Sarai described, we have the primary prevention with the vaccine, but we also need to look at those who weren't eligible for the vaccine to try to detect precancerous lesions early and prevent those from progressing on to cancer. So those are opportunities to eliminate cervical cancer, both in Canada, but also globally.
And this is kind of where genomics comes into play, right? Because now there is, what's our favorite thing as women to do? It's get a pap smear at our doctor's office. Yay! No, we don't like that. And with the research that you've done, and this, particularly helps women in areas that don't have access to yearly pap smears or twice or every 2-year pap smears, that sort of thing, where you have a self-collection, a way of women getting self-collecting to see whether or not they have HPV.
So if we think about so pap smears have been great. Let's be clear. They've offered us some important prevention. But as one of our great colleagues likes to say, pap smears came around in the 1950s and 60s. So look around your house, look around your kitchen, look around this room. Is there anything in here from the 1950s or 60s? No. So technology's moved on. So we're going to be moving on as well. And as we discussed, because we know that HPV is what causes cervical cancer, what we've been able to do, and when I say we, it's the global scientific community, has been able to, using molecular tests, better able to detect not the changes to the cells, but actually the presence of the infection, the presence of the virus. So that's where our molecular advances have been so critical. Yeah. But the other advance that you talked about, which is really exciting, is for the pap smear to work, the practitioner actually has to visualize the cervix. So you have to undergo a pelvic examination, because you need to take the scraping from that part of the body, from the cervix. Whereas for molecular tests, you can just take a swab yourself. So it's sort of like inserting a tampon. You insert a swab intravaginally, you take a sample, and you can just put it into a tube. So there's two parts to that sort of advance. The advance of one using molecular tests, and we were able to show, and we can talk a little bit about it later, we were able to show in British Columbia that that's better than a pap smear. But then also we can use self-collection to improve uptake of that screening. So it's great you have a great new technology. We also got to make sure people are using it as well.
And how we had talked earlier before we started this podcast that this tool, self-collection tool, actually has a greater and longer rate of testing to see whether or not the infection would cause a problem in the future.
Right. So yeah, that's actually the attribute of the molecular test. So compared to the PAP, it's what we call is we're looking at when you're negative. So when you get a test, and say I get a PAP and it says I'm negative for any cellular changes, or say I got an HPV test that said I was negative for HPV. The negative, we have a lot more confidence in the negative from the HPV test. So what that says is for a longer period of time, 4, 5, 6 years, we can know that you're not going to progress to any precancer. So that sort of, that rate is better with an HPV test than it is with a pap smear. And so that attribute also holds true for self-collection. So we can offer this test that is more accurate, but also gives you more comfort and confidence and assurance with your results as well.
Where do you think we're going to be 5 years, 10 years from now in BC, in Canada, and around the globe in terms of cervical cancer? When do you think that we can eradicate this disease once and for all?
It's such a great question. So I'm very fortunate to work with the WHO, and they have named elimination of cervical cancer as one of the top public health threats to deal with. So that's really important because what it allows countries and nations to do is to come together to address this. So Canada, under the leadership of the Canadian Partnership Against Cancer, and here in British Columbia, under the leadership of the BC Cancer Agency and folks like Dr. Bonnie Henry, have named cervical cancer as one of our priorities to eliminate. So I think there's a couple of steps. I think the work that Sarai and the team is doing about improving uptake of the vaccine is so critical. Helping parents understand the safety, efficacy, important value of this vaccine and really bolstering our vaccine confidence. The next thing we need to do is move from our PAP program, which has, as we said, has served us well, and transform and transition to HPV testing. And I know that both the BC Cancer Agency and the Ministry of Health are working hard at getting that implemented. So where do we see ourselves? Well, CPAC has set, the Canadian Partnership Against Cancer has set some high goals for us. 90% coverage of the vaccine, 90% coverage with HPV testing. So they've set those aspirational goals. We need to achieve them, because if we achieve that, we are going to start to see significant reductions and elimination within the next sort of 2 decades. So, I think our hope, Sarai and I, is that we want to see us well on the way to elimination by the end of certainly my career. Sarai's much younger than me, so hopefully in the middle of her career, we'll start to see that move. Sarai, I don't know if you have any comment on that.
I just wanted to expand on, thinking about how we're going to get to that 90% screening, and that self-collection, I think, is going to play a really big role in that. We look across Canada for cervical cancer screening rates. They also have remained stagnant around just below 70%. So thinking of, how do we capture 20 to 30% of the women into a cervical cancer screening program to achieve elimination and to achieve that very high bar. And I think self-collection is going to play a really important role in being able to offer screening to women who do not have access or don't have, it's available, but they feel uncomfortable accessing it, whether it's, because they live in a really small community and they don't have that relationship. They don't want that relationship with their family provider, that they don't feel comfortable with a pelvic exam for numerous reasons, that there's barriers that they've experienced that self-collection can help address. And so I think for me, self-collection is really it's a patient-centered approach to cervical cancer screening, to having an option for them to help engage them or re-engage them in screening.
So one final thought for both of you. If there is a mom or a dad out there listening and they have a 10 or an 11-year-old child and they're not sure, what would you urge them to do to show them how safe the HPV vaccine is, so their daughter doesn't have to get cervical cancer like my friend did a decade ago, and leave behind 2 young kids? What would be your advice to them?
So Renita, I'm going to start with your story. I think one of our challenges with cervical cancer is we don't tell the stories, and we need to tell the stories, because it's heartbreaking to think of a family who didn't need to lose their mom, who didn't need to lose their partner, who didn't need to lose their daughter, who didn't need to lose their work colleague, who didn't need to lose their community leader. So, I start with that story. I also explain to folks that we're very fortunate in BC in that, based on the way we've organized our health system, we actually have some incredible data. And our data has already shown we have drastically reduced our precancerous lesions in young people, in young women who've had the vaccine. We have drastically reduced our overall rates of precancerous lesions. We've already shown that in under a decade. So imagine where we're going to be. And what breaks my heart is to think that there's, as Sarai said, 30% of young people who aren't going to get that benefit. So what I say in my practice all the time with folks is it's a safe vaccine, it's a highly effective vaccine, and I strongly recommend you vaccinate your children against HPV.
Thanks, Gina. Sarai, how about you?
Yeah, I think, in talking to parents, neighbors, friends, colleagues, I think Gina stressed a nice point around sharing stories. And we connect, we're humans, we connect over stories. And so I always like to share sort of that evidence-based part, but then also sharing my own experience of, I plan on vaccinating my children. I elected as a 20-year-old to get the HPV vaccine because I believed that it was important, and it was amazing that we had a vaccine that prevented cancer. Stressing that, when I speak to parents, we all want the best for our children. And so I think it's important to share those stories and to share your confidence in vaccination and the HPV vaccine, specifically around preventing cervical cancer when we're talking about our young people and providing them protection over their lifetime.
Well, thank you both, Sarai, Gina, for the work that you do, which is so incredibly important. Thank you for saving lives. And I look forward to 10 years down the road, and you would play such an important role in eradicating cervical cancer here and hopefully around the world. Thank you.
Thanks for having us.
Yeah, thanks for letting us share. Fantastic opportunity.